Hello everyone, my name is Arjun Kode and I am from Orchids International School Seawoods branch. I am in grade 8A and me and my partner David have made a PPT on healthcare issues in India. For example, as India's population is rising, there are few less doctors for patients. We don't have enough technology to find cures for many diseases, and we are not technologically advanced as other countries. My partner and me have noticed these issues and put them in our PPT. My partner Divit will address these issues furthermore. Please, Divit, continue.
Good evening, everyone. I'm David Choisha from Grade 8A, Orchestra International School, Seawoods Branch. And as my co-delegate partner, Arjun has explained about some issues about healthcare that are happening in the country because of shortage of doctors and lack of technology, which is very pathetic, not only according to me, but according to our countrymen and etc. Before addressing the solutions, I have a case study to notice upon. So, there was a farmer named Ramesh Kumar who was about 52 years of age. In the early start of the year 2024, he had some cardiac diseases like severe chest pain and struggling to breathe, because of which and due to lack of healthcare, he had to shift to New Delhi. However, there were many challenges faced, such as traveling 1,000 kilometers by train and spending about 5,000 on healthcare. And then since there were so many patients around, the other patients, operations, treatments, they were being delayed and their conditions got worse. Which same happened with Ramesh Kumar. His diagnosis was being delayed and treatment was also being delayed, because of which his condition got worse and his wife had to shift back to Delhi and to Bihar, and he and his son was still in Delhi, and he had to manage the hospital logistics. And and to prevent these, I have some solution to present on to the inequitable access to healthcare centers in our country. We can build more healthcare centers in rural areas. We can also introduce online portals or online apps for healthcare, such as the famous eSanjeevani, which is a national healthcare web portal created by the government of India for the patients from rural areas, so that they can communicate with the doctors online. We have also Tata 1mg, which is a very great example for the online apps that are dedicated to healthcare. Since we know, since we know that getting a quick report is necessary. So for that, Tata 1mg is the best, as it shows a report within 5 minutes after our appointment. It tells you what to do and what not to do or before the appointment, which is good, extremely important, and also a sign of a developing to prevent inequitable access. Then, to about shortage of doctors, our, our doctor to population ratio is considered low according to the World Health Organization, the WHO, which is about, to the government reports, a ratio of 1 is to 834 people, which is pathetic. And hence, to prevent this situation, we can hire more doctors through advertisement, and we can also increase the reservations for lower caste and expand the medical colleges around our country, so that students can automatically can take interest in the in medicals. If we expand our reach and benefits to government funded insurance to include primary health care, we can we can automatically reduce the out of pocket expenditures. And if we see our national health policy of 2017, We have a target of spending about 2.5% of our GDP in for health. However, if you want to prevent hospitals and regular medicines, as we know that, so the statement prevention is better than cure is very useful. And there are only main three things that were followed in the ancient times to prevent such diseases. First of all, yoga. It helps in your flexibility, body circulation, and many mental faculties that we face in our day-to-day life, such as we feel sad, then maybe basically unhappiness, then we also sometimes feel restlessness, restlessness, and we also face chronic depression and etc. To prevent these, we have yoga as a solution. And as we know that many of our children are suffering from cholera, malaria, dengue, common cold, and typhoid. To prevent these, we can tell them that to do sanitation. And as we know that children can't easily know what is sanitation, we can explain them by some act. Like you can tell them to wash your hands, uh, eat your food in clean areas, and etc. We can we can help them to know about sanitation, why is it important to follow, and what are the benefits. Lastly, if you notice that there is a lot of environmental instability in your area, or you feel your weight is increasing rapidly, you are facing some problems uh in your like in your chest area, you can use Ayurveda. If you start a healthy diet and lifestyle, you can prevent environmental imbalances through herbal diets. And we can also prevent ourselves from obesity and heart attacks by maintaining a healthy, balanced diet. Thank you. Hope our presentation created a big impact on you. Thanks. I mean, thank you.
Thank you.